Hello, today we are going to demonstrate a glucose test or a blood glucose test. Before we get started, let me just go ahead and show you what we have here. We have some 2x2 gauze, a Band-Aid, alcohol swab, a sharps container, and our glucometer. They're all a little different. This one, I love this one. It actually is very small, sleek, looks like a big flash drive. One of the most important things, and I did mention this on the video about point of care testing, so if you haven't watched that, you'll definitely want to check it out. Your glucometer and your strips need to match, meaning they need to be the same brand. So this is a Contour one, not advertising for them at all, but this is also Contour. So they need to make sure that they're matching, otherwise they won't work together. Okay, and then we have our patient here. May I get your name and date of birth, please?
My name is Penny Lane, and my date of birth is October 1st, 2000.
Wonderful, that matches my requisition. So I'm just going to go ahead and we're going to wash our hands. Use some hand sanitizer since I'm not near a sink. All right. Get some gloves here. Have you ever had this done before, ma'am?
I have not.
Okay, so basically what we're going to do is we're going to check the level of glucose or sugar in your blood. And we're just going to do that by just a small little stick of the finger.
Okay.
Get a little blood out. We're going to put it in this machine and it'll tell us what that reading is.
All right.
One thing I do not have is a Lancet. Here is my Lancets that I like to use. They're pressure Lancets. These are the greatest, my favorite. Okay. So, next what we're going to do is we're going to go ahead and inspect the hand. Do you have a preference?
No.
No? Okay. We're going to go ahead and inspect the hand. What we want is a nice, clean, non-injured, non-scarred, non-calloused finger, if at all possible. The best fingers to use are the third and fourth digit, or the middle finger and the ring finger. They're a little meatier than the others. You don't want to use a thumb, and you don't want to use a pinky finger. It's too small. And the index finger, we just use that a lot. So better to use the others. So we'll just go ahead. We're going to go ahead and use her middle finger, I think. So we're going to go ahead and get the alcohol prep pad. We're going to clean that area. Now, I'm sure you're going, wait a minute, you haven't put the strip in yet. No, I have not, because if you put the strip in and leave it for too long, it will actually shut off. So what I do is, while I'm waiting for that alcohol to dry, because you never want to stick or puncture the skin with wet alcohol, it'll push the alcohol into the wound and it stings, and we don't want to do that to our patients. This is when I go ahead and I get my strip out and put it in the machine. That way, plenty of time for the alcohol to dry and plenty of time for this to get going. So you go ahead and you just stick the strip in. This particular machine, as most machines these days, once you stick the strip in is what turns it on. Okay, and then it'll give you a little beep and let you know that it's ready for blood. I'm going to go ahead and uncap the Lancet. Hold the finger nice and still, just to the side of the center of the finger, and we're going to just do a little countdown so she doesn't jump. A 1, 2, 3 little stick. This goes directly into the sharps container. Her hands are a little on the cold side, but this first drop of blood is primarily plasma. We're going to go ahead and wipe that away. And then we're going to get a nice big drop of blood right there. Take the end of the strip, just touch it to that drop of blood, and it will just suck it right up, give you a little beep, knowing it's working. I'm going to go ahead and have her hold pressure on that for just a little bit to get the bleeding to stop while we're waiting for the reading. And her reading is 91, which is very good. Very, very good. All right. Then we're going to go ahead and make sure we take care of our patient here. Okay, a little more pressure just for a moment. I'm going to go ahead and take my strip out, and since it has blood on it and I have blood on this, I'm just going to go ahead and wrap them up together. We'll dispose of those here in just a minute. All right. Okay, let's take a look-see. All right, perfect. We'll give her a little Band-Aid as a souvenir for being a brave soul. There we go. We will document that, report it to the provider, and we will see what they have to say and hopefully send her on the way. All right, that is it. Thank you so much.